My name is Kelly Cartwright and my motor learning task is hair braiding. For the task component, it was a stable task because my base of support, which is my feet and my hips, were stable and my upper extremities were manipulated as my hands and fingers coordinated with each other in order to formulate the braid. It was a discrete task because it was clear to me where exactly I needed to begin, the top of her head, and where I needed to end, the end of her head hair. It was a closed task because there was a repetitive, predictable, and stereotyped pattern with each braid. The individual components of this task consisted of perception, cognition, and action. For perception, I needed my proprioception, somatosensation, visual, and vestibular systems to be intact. For the action component, I needed an intact motor output from the nervous system and the descending systems, which includes the basal ganglia, cerebellum, and motor cortex, to produce voluntary movement, balance, coordination, and executive motor planning in order to produce the hair braid. I also needed a lot of coordination skills. Cognitively, my goal for week 1 was to produce a coordinated and symmetrical French braid. Initially, I had selective attention for producing this braid, and at the very end of this week, I progressed to learning how to perform a fishtail braid. My subject taught me how to do this with simple part to hold steps where I started to make the braid from the side of her head, which was easier, and I then progressed to doing so from the very back and center of her head. For the environment component, it was regulatory constraints, consisting of my subject's hair is fairly light and slightly wavy, making it easier for this braid. For non-regulatory, consisted of performing multiple forms of distractions that have been added after the first day of my hair braiding experience, that is, noise from the TV, music, and other people, which made it more difficult for me to focus. Type of feedback was intrinsic, that is, me personally seeing it, and extrinsic. After taking photos of her hair, I showed the photos to her and she commented and noticed that I did a better job and finished faster. Type of learning was modeling, where I used a YouTube video, French braiding for learners, for beginners. Stage of learning hair, definitely cognitive and explicit, and it was mass and constant practice. For week 3, my TIE remained the same. However, my goal, I was able to increase my taxonomy by producing this French braid by adding a time factor and while um, tool tasking. For the first attempt, my time was 3 minutes and 16 seconds, and at the end of week 3, I successfully completed this task within 2 minutes and 35 seconds while watching TV and conversing with friends. I received less feedback, that is, intrinsic and external, as the week progressed, and I performed massed practice and constant practice, and I am now in the associative stage because I am performing less errors and I'm able to add a tool task. My goal for week 6 was to produce 2 symmetrical French and fishtail braids combined, while dual tasking, that is, conversing with my subject. I thought that this was going to be just as hard as the previous week because now the goal would be for me to complete this complex braid symmetrically, which would have been very challenging. Completing one out of the 2 small braids was actually more challenging and physically demanding on my arms. I literally felt my muscles were working harder as opposed to me just trying to produce a nice looking braid. I initially completed this braid in 7 minutes and 30 seconds, and my best time was 6 minutes and 28 seconds. However, I did not include the time factor as a part of my goal. On the third day, my subject got a trim, which actually made the task slightly easier because it was less hair to braid, which meant less hair tangles, which meant less complaining that I had to deal with from my subject. As the days progressed, my arms were not working as much. I became more adapted to my arm being in that position, and the twin braids were becoming more symmetrical and were starting to have a lot more shape. Clinically, it is important for me to realize that I need to set realistic goals for my patients. Being patient with myself and overall with my patients because their ability to learn and retain information is obviously not going to be how it used to be after a neurological injury. Reassuring them that it is okay to mess up. Some days and weeks are better than others. Empathize with their struggle, but also know that you can and should increase the intensity or taxonomy to actually create progress and change. Practice, practice, practice. Consistency is key. Also, having internal motivation and enthusiasm is key. Having a positive outlook and attitude can make a big difference. Have, Providing visual feedback such as video and photos can be beneficial for patients to actually see their progress, as well as adding a time factor as a baseline and to see their change, change, change and improvement, and also knowing when to provide feedback.